Thank you very much, Anna. Our next respondent is Clay Marsh, Vice President and Executive Dean at the West Virginia University School of Medicine. Dr. Marsh.
Thank you. It's a pleasure to be here and representing West Virginia University and the affiliated academic medical centers, Marshall University and the West Virginia School of Osteopathic Medicine. We are very excited and committed to trying to help the substantial problem that faces the state of West Virginia. As you saw from the map earlier, we have the most deaths from overdose in the country at 35.5 per 100,000. We had stories run on CNN, USA Today, where there was 27 911 calls for drug overdoses in a 4-hour period at one point. So West Virginia, in many ways, is in crisis. And as we look at the role of our academic medical centers in the state, and particularly West Virginia University, which is the land-grant university of the state, we see our role as being one to solve the important problems of West Virginia and beyond, to work collaboratively, not competitively, in other words, in series, not in parallel, and to work bottoms up, not top down. And I love the analogy for outcomes-based as opposed to process-based, because indeed, that's what we're trying to do. Related to addiction medicine, when I first came back to West Virginia University, I'm a native and came back about 2 years ago. We took a round of all of our congressional delegation here in Washington, and all anybody said is, what are you going to do about the opioid problem? What are you going to do about the opioid problem? What are you going to do about the opioid problem? So I decided that the opioid problem was going to be a high priority after that. And indeed, with the governor of the state of West Virginia, we have created a multidisciplinary task force that's led by the dean of our School of Public Health and by the chair of our Department of Behavioral Health and Psychiatry, and have focused on trying to create experiential and interprofessional learning opportunities for our students. As Dr. Kuntz has suggested, addiction medicine fellowship is something that is badly needed in our state. We, I believe, have 6 addiction psychiatrists in the state of West Virginia. And to the credit of our faculty practice plan and hospital, we jointly funded 2 positions for an addiction medicine program, which will start in 2017. We also believe that the best learning happens at the places of delivery of care. And so we have put students and created educational threads, not only through our curriculum that is all health sciences, which includes medicine, nursing, pharmacy, public health, and dentistry, but is also in our chronic opioid addiction treatment program, in our injury control research center, where we teach first responders to administer naloxone, in our drug management programs that focus on not only limiting prescription authority and teaching people, but also in putting naloxone in the hands of people that need it. We have also, in response to our practice-based research network sites, we have established the ECHO, the Extending Community Health Outcomes Program in West Virginia, and are working with community practitioners and groups and critical access hospitals to be able to administer the appropriate treatment. And we've extended the ECHO program now from the treatment of addiction-related infectious diseases to the management of people with addiction problems. We've included students in this as well. We are also working with Dr. Tripp Buchenmeyer and the Uniformed Services University. Dr. Buchenmeyer is in the back, Colonel Buchenmeyer, who is the director of the Defense and Veterans Center for Integrative Pain Management. And so we are trying to create solutions that are non-pharmaceutical based to help people establish different approaches to pain management. And much like Dr. Buchenmeyer, we believe that prevention is more important than treatment, so we are working our way to reach the communities in the state of West Virginia, because as Sam Quinones, who's the author of a great book on addiction and heroin, the black tar heroin epidemic, Dreamland, said, that isolation is the critical feature that may predispose people to the risk of addiction problems. And in fact, the breakdown of communities and the economic base and the educational base of part of our state, we believe is a contributing factor. And in fact, we have students in communities working with community advocacy groups and coalitions, then learning to rebuild communities and rebuild hope and a better future. So thank you.
Thank you, Dr. Marsh. Dr. Marsh is one of 6 deans who will be